Hi Cindy, I'm here to talk to you today about what we can do for your panic disorder because you're not responding to CBT therapy. And I actually found this really interesting article that talks about non-responders to CBT for panic disorder and kind of what we're going to do next for this. So this study that I found actually looked at non-responders to acute CBT and kind of different options for them. So what they did is that they took 88 non-responders to acute CBT and asked them if they'd like to participate in this study, and 30 actually declined to participate. But we had 54 who were willing to participate in this study. So they broke them down into 24 who continued their CBT treatment and 34 who started an SSRI treatment, which is a medication to help treat their panic disorder. So before they started their treatments, they actually got their panic disorder severity scale numbers to measure how high their panic disorder severity was before they started their treatment. So they continued their treatments for 3 months, and at the end of 3 months, which is time 3 if we look at this chart, they again measured their panic disorder severity scale, and they also measured their clinical global improvement scale measure. Participants in the study also had the option of continuing their treatment that they were on, so continuing their CBT or continuing SSRI treatment for an extended time, and if they did, they would also get their measures for panic disorder severity scale and clinical global improvement scale at the end of time 4, and that would be at the end of 12 months to see how those measures ended up also. As you can see, however, if we look at the numbers here, they did have a high attrition rate, which means that they did lose a lot of people, especially at the end of 12 months. So we got to keep that in mind when we're looking at these numbers. So what did they find? So if we look at the first table, table 4, this is comparing the two groups. So it's comparing SSRI treatment and continued CBT treatment. So time 1, so this is before the treatment group starts. So time 1, they found that there are barely any differences between the groups, which is kind of what we expect to find because their treatment has not started yet. And if we look at time 2, they found that people in the SSRI group had slightly more severe symptoms than people in the continued CBT group. And then if we look at time 3, they found that people in the SSRI group had moderately less severe symptoms than people in the continued CBT group. So if we look at our chart that I put on here, we can see that at the end of the treatment, so time 3 is the completion of the treatment, the participants who were in the SSRI treatment group had moderately less severe symptoms than people who were in the CBT treatment group. Now, if we look at table 2, this is looking at, so if we look at table 2, we're looking at response to the treatment in assessed participants who do not have major depression along with panic disorder, which you do not. So we're looking at the success of the treatments and simply just panic disorder. So if we look at this table, we see that there is a 60% success rate in SSRI treatment versus the 38% success rate in the CBT treatment. Like I said earlier, how they lost a lot of people from time 3 to time 4, they didn't conduct a formal analysis from time 3 to time 4. However, at time 4 for the SSRI group, there were 13 people who were still participating and taking their SSRIs 11 of those 13 people were still maintained treatment and were still responders to SSRIs. On the flip side, though, for the continued CBT condition, there were 8 people at time 3, and we lost 2 participants, so we ended up at 6 at time 4, and all 6 people were responders at time 4. So what does this mean for your panic disorder moving forward? Considering that we've gone through CBT, you feel like you're not responding to CBT, we haven't seen improvements. So what does this mean moving forward? I think this means that you have options. There are different options other than CBT, and SSRIs might be an option that we could try moving forward. And if that doesn't work, we could always go back to CBT, or we could do a combination of both. But I think this really means that we have options moving forward.